Today po ma'am, this time ma'am is the last session which I will be discussing my intervention to your pain. So as you remember last time po when I interviewed you that you mentioned that you are experiencing pain in your left lower of your stomach. So this time ma'am I will discuss how to prevent for the possible prevention to your pain ma'am. So this is very applicable that I created the topic that is very applicable to your experience. So ma'am, as you have seen ma'am, the topic that I prepared to you is all about dehydration. So the title is "Don't Let Dehydration Drain Your Energy. Drink what?" So ma'am, the definition of dehydration ma'am, this occurs when you use or lose more fluid than you take in and your body doesn't have enough water and other fluids to carry out its normal functions. If you don't replace lost fluids, you will get dehydrated ma'am. So this dehydration ma'am, it has a type, and so that is the type of dehydration ma'am. We have hypotonic, hypertonic, isotonic. So hypotonic ma'am is mostly caused by diuretics which cause more sodium loss than water loss. So hypotonic dehydration is characterized by low sodium and osmolarity. So ma'am, as in other explanation ma'am, hypotonic ma'am, this is too much water loss or not enough salt. So this means ma'am, when there is not enough salt present in your body, it can disrupt these important functions and lead to symptoms such as muscle cramps. So did you experience that ma'am? Muscle cramps, confusion sometimes, and even death in severe cases. So therefore, in cases of hypotonic dehydration, it is crucial to not only replenish the lost water but also ensure adequate intake of salt to restore electrolyte balance and prevent further complications. And next ma'am is hypertonic. So primarily loss of water. So as you can see ma'am, this occurs when water losses exceed sodium losses. So serum sodium and osmolality will always be elevated in hypertonic dehydration. So excess pure water loss occurs through the skin, lungs, and kidney. So I search in other explanation ma'am that in hypertonic there is too much salt loss and not enough water intake. So the body fluid balance is disrupted, leading to dehydration. So the symptoms of that ma'am is excessive tears and mucous membrane, decreased urine output, dizziness, confusion in severe cases. So it is very essential po ma'am that in hypertonic cases, you should not only replenish lost salt but also increase fluid intake. And last ma'am is isotonic. So isotonic is equal loss of water and electrolytes. So this occurs when water and sodium are lost together. So causes of isotonic water loss are vomiting, diarrhea, sweating, burns, intrinsic kidney disease, hyperglycemia, and hypoaldosteronism. So that is the type of dehydration. So this is the causes of dehydration. We have diarrhea, vomiting, fever, excessive sweating, increased urination. So We have also effects of dehydration on the body, ma'am. So, can you read this, ma'am? And can you check those effects of dehydration that you have experienced? So, like xerostomia. So, effects of dehydration: xerostomia, tears, headache, muscle cramps, constipation, mental pain. So, yeah. So, thank you, ma'am. Next is, ma'am, we have signs and symptoms. Signs and symptoms of dehydration, ma'am. So, I will give you a copy. Can you check also the symptoms and signs that you're experiencing? So, we have tears for signs of mild or moderate dehydration. This includes the tears, dry or sticky mouth, not peeing very much. We have dark yellow pee, dry cool skin, headache, muscle cramps, dry cough, low blood pressure, loss of appetite or sugar craving, flushed skin, swollen feet, chills, constipation, shriveled skin, lack of sweating. Okay. For the symptoms, ma'am, so can you check for it, ma'am? Signs and the symptoms of dehydration. So this includes for the symptoms, we have headache, delirium and confusion, tiredness, dizziness, weakness, lightheadedness, dry mouth, or a dry cough. So that is the example of symptoms of dehydration. Okay, ma'am. Thank you, ma'am. I will give you a copy, ma'am. So short. Okay, ma'am. Next is, ma'am, risk factors for dehydration, ma'am. I included the environment, so as you have seen. So for environment, ma'am, when hot and humid weather, this can increase the risk for dehydration, ma'am, due to increased sweating and fluid loss. So if you experience when you expose yourself or in the hot weather, ma'am, so you experiencing sweating. So high altitudes can also increase the risk of dehydration due to increases respiratory water loss. And next, ma'am, we have physical activity. So strenuous exercise or physical activity can lead to increased sweating and fluid loss, increasing the risk of dehydration, ma'am. If you use your too much strength, ma'am, in the activity, ma'am, you will experience sweating and fluid loss. So next is we have illness, ma'am. Illness. So like fevers, vomiting, and diarrhea can lead to fluid loss and increase the risk of dehydration. And we have also age. So infants, young children, and older adults are at higher risk of dehydration due to their smaller body size, higher fluid turnover, and decreased ability to regulate body temperature. Then we have also chronic health conditions, ma'am. So, certain medical conditions such as diabetes, kidney disease, and adrenal gland disorders can increase the risk of dehydration. Then, we have also medications, ma'am. So, tulad po ng diuretics, laxatives, and antihistamines, it can increase fluid loss and lead to dehydration. And we have also alcohol and caffeine consumption. So if you are experiencing dehydration, ma'am, caffeine and alcohol consumption is not allowed po. Because this leads to dehydration. Lack of access to water, ma'am. That is the sums of reasons that some of the people experiencing dehydration because they can't access water. So next is poor hydration habits, ma'am. So not drinking enough fluid throughout the day or emergencies can increase the risk of dehydration. And next is pregnancy and breastfeeding, ma'am. So women have higher fluid needs and may be at increased risk of dehydration if they do not adequately replace lost fluid. So, as you have seen, ma'am, that is the risk factor for dehydration. Next is, ma'am, we have diagnosis of dehydration, ma'am. If you want to test yourself if you are experiencing dehydration, you can test yourself by blood test and urine test. So, yun, ma'am. Next is treatment of dehydration, ma'am. So, as you can see, ma'am, the treatment for dehydration is to replace the fluids. So, yeah, fluids and electrolytes that you have lost. For mild cases, you may just need to drink lots of water. If you lost electrolytes, sports drinks may help. So, there are also oral rehydration solutions for children. So, for mild dehydration, ma'am, you can drink fruit juices, tea, and soda. So, not alcohol or contains caffeine, ma'am, because this will increase your dehydration. Next is for moderate to severe dehydration, ma'am, you may need IV fluids, ma'am. Severe dehydration is a medical emergency. It needs to be treated right away with IV fluids to the hospital. So next is we have prevention of dehydration. To prevent dehydration, drink plenty of fluids and eat foods high in water such as fruits and vegetables. So letting tears be your guide is an adequate daily guidelines for most healthy people. So people may need to take in more fluids if they are experiencing conditions such as vomiting or diarrhea, ma'am. So as you can see, ma'am, if you are experiencing dehydration, ma'am, you can eat food that contain water such as fruits and vegetables, ma'am. So the best way to prevent dehydration is to remember to drink plenty of water throughout the day. In addition, be sure to increase your fluid intake on hot or humid days or before or after exercise. And you can carry water bottle with you so that you cannot forget, ma'am, to drink. So if you work outside, be sure to take frequent breaks in a cool or shady place. So it's wise to avoid carbonated or sugary drinks, caffeine, and alcohol, as all of these can dehydrate you, especially when it's hot outside. So, emergency response to severe dehydration, ma'am. So, for severe dehydration, ma'am, as I mentioned earlier, ma'am, that you should use fluid or IV fluid. If the patient can drink, give ORS by mouth while the IV drip is set up. So, ayan. So, we have also guidelines, ma'am, and best practices to become hydrated, ma'am. So, we have five guidelines and best practices, ma'am. We have set daily water goals. So, if you want to become hydrated, you should set goals to drink water. So, establishing daily water goals can help you track and ensure adequate hydration. And next is, ma'am, we have drink water regularly. The next is monitor urine color, ma'am. So, monitoring the color of urine can serve as an indicator of hydration, ma'am. So, as we are experiencing dehydration, ma'am, we should check our color of our urine. So, next is incorporate hydrating food. So, not only drinking water, ma'am, you should also eat fruit that contain water, ma'am. So, yeah. Some fruits and vegetables have high water content and can contribute to your overall hydration. So, such as watermelon, cucumber, oranges, strawberries, and leafy greens. So, yeah, ma'am. So, next is be mindful of environmental factors because our environment, ma'am, can contribute factors for us to become dehydrated. So, staying hydrated is crucial for maintaining optimal health and well-being. By setting daily water goals, drinking water regularly, monitoring urine color. So, that's our goal, ma'am. Drinking water regularly, monitoring urine color, incorporating hydrating foods, and being mindful of environmental factors, you can prioritize hydration and ensure that your body receives the fluids needs to function as its best, ma'am. I've searched the reason why we need to drink water, ma'am, because fluids help to move nutrients and waste through your body. So it keeps your body pressure normal, it protects and cushions your joints and organs, it controls your body temperature, and it can lower the risk of dehydration and heat loss. So that is very important to drink water regularly. Ma'am, I have small cards. So I will give you this, ma'am, to be to help you remind that you should drink water every day. Ma'am, can you state what I've written there, ma'am?
Stay dehydrated. I pledge to drink of plenty of water every day.
So that is your assignment, ma'am. Ma'am, I will give you a copy to encode your intake and output fluid. So thank you, ma'am.